Could something sitting in your medicine cabinet actually be making the ringing in your ears worse? The answer is possibly. Hi, I'm Chuck Smith, owner of Affordable Hearing, with locations in Rochester, Logansport, and Lafayette, Indiana. And there are certain medications that can cause tinnitus or make existing tinnitus more noticeable in some people. But before I give you this list, this is extremely important. Do not stop taking a prescribed medication because you saw this video or searched something online. Always talk with your doctor before stopping any medication. Here are 8 types of medications that have been associated with tinnitus that you should know about. Number 1 is aspirin, especially at high doses. High-dose aspirin has long been associated with ringing in the ears. But we're generally not talking about the common 81 milligram baby aspirins that many people take for cardiovascular reasons. At higher doses of aspirin, tinnitus can occur. And fortunately, it is often reversible once the dose is reduced or the medication is discontinued under medical supervision. Number 2 is NSAID pain relievers. That includes medications like ibuprofen, Advil or Motrin, and naproxen or Aleve. Tinnitus can occur, particularly with larger doses or more frequent use. Number 3, certain diuretics. Medications like furosemide, also known as Lasix, bumetanide, and ethacrynic acid potentially affect the inner ear. The risk tends to be greater with high doses, rapid IV administration, or when they're combined with other medications that can affect hearing. Number 4, aminoglycoside antibiotics. These include gentamicin, tobramycin, and amikacin. These are powerful antibiotics typically used for serious infections, and unlike many medications, related cases of tinnitus, they can sometimes cause permanent inner ear damage and hearing loss. Number 5, certain chemotherapy medications. Cisplatin is probably one of the best known examples. It can damage the inner ear and cause permanent hearing loss and tinnitus, which is why hearing monitoring can be important during treatment. Number 6, quinine and quinidine. These can cause ringing, changes in hearing, and sometimes dizziness. And yes, tonic water contains quinine, but in much smaller amounts than medication doses. Number 7, some antidepressants. Medications such as bupropion, citrulline, and venlafaxine have been associated with tinnitus in some patients. But this one is complicated. Anxiety and depression can also make tinnitus much more bothersome. So these medications may actually help some people's tinnitus while occasionally triggering or worsening it in others. Number 8 is PDE5 inhibitors, such as Viagra and Cialis. These are rare, but sudden changes in hearing have been reported with these medications, sometimes along with tinnitus or dizziness. And this one deserves special attention. If you experience a sudden decrease or loss of hearing, especially in one ear, don't wait to see if it gets better. Seek medical attention promptly. Now, here's what I really want you to remember. Just because tinnitus is listed as a possible side effect does not mean you're going to experience it. Most people taking these medications will not. And sometimes the medication is treating something far more serious than the tinnitus itself. So again, never stop a medication on your own. But if your tinnitus suddenly started or became noticeably worse after beginning a new medication or changing a dosage, tell your healthcare professional who prescribed it. And have your hearing checked, because tinnitus and hearing loss very often occur together. If you're dealing with ringing, buzzing, humming, or another sound nobody else can hear, don't assume there's nothing you can do about it. Start by figuring out what is causing it. Have you ever noticed your tinnitus change after starting a medication? Let me know in the comments below.